On a remote stretch of highway between Sydney and Adelaide, the Barkindji people of Wilcannia have been in a public health crisis for decades.
Wilcannia has some of the worst health outcomes in the state, so some of the lowest rates of life expectancy, highest rates of preventable death, very high rates of suicide, tragically.
"18 months ago, the state and federal governments were warned Wilcannia faced disaster because of chronic health problems and overcrowding.
We was very worried about, the virus getting in because of the damage it will do if it gets into one household. And it will only take one household to be infected, and then it'll just go from there like wildfire."
From mid-August, COVID tore through overcrowded public housing here, where less than 1 in 5 residents were vaccinated. Peter Murphy was one of the first infected, in a house where 20 people shared just 4 bedrooms.
My partner rang around and tried to get somewhere for us to isolate, but they couldn't do anything.
They discovered the state had no accommodation for isolation in Wilcannia, despite 18 months of planning and decades of warnings of a dire housing shortage.
The only information was given to those that had the virus was isolate, and they're like, where? Where do I isolate?
Peter and his partner, Marjorie Wyman, brought their children to this squalid property where 10 people took shelter. All 10 caught COVID.
When we moved in, we didn't have hot water. Our toilet was clogged up and we didn't have a fridge, washing machine. This is the room where me and my partner and 3 kids isolated. Probably isolated there for about a week and a half or something.
The family of 5 shared 2 mattresses in this tiny granny flat.
I had aching bones, headaches, just constantly spewing.
As COVID numbers surged, some families said New South Wales Health didn't contact them.
They just didn't get the phone calls. They didn't get people coming to the home to check on them to make sure they're okay in that first 2 to 3 weeks. The response was totally inadequate.
Yeah, it's this where we had our kitchen in here.
Residents like Peter were forced to improvise.
I just want to show you that bathroom. That's my half a door.
With no hot water, Peter Murphy didn't wash. The state government was quick to blame the Wilcannia community, saying a large funeral had started the outbreak. The death of a young man had attracted mourners from afar.
There is no time now to be selfish. You could be responsible for people's deaths. 300 plus people attended a funeral in Wilcannia, illegally, you could argue. I don't think you could ever prepare for such an outcome. No different to the 16 dickheads in Maroubra that decided to have a party last week.
I was very, very angry. He was saying that we were locked down when we weren't, and the number of people that he mentioned in it was wrong, so there was no respect.
The government claimed it was caught off guard. But the state could have been prepared. Minutes of crisis meetings that we've obtained show the community here started warning senior state officials 18 months earlier that funerals or travellers could bring COVID to town.
When we was preparing way back then, we all said to the police, this is where you need to enforce the law, because, if family going to travel home, and a lot of them will, we don't want them here because we want to stay protected. Didn't know what to make of it.
From the start of the pandemic, Wilcannia elder Monica Kerwin sat on the town's local emergency management committee, a body designed to protect Aboriginal communities from COVID. The committee was run by New South Wales Police and attended by senior state officials, including from New South Wales Health.
Our opinion was never considered at that table as, a valued opinion.
In March 2020, elders asked the state government to ban visitors to Wilcannia.
We wanted signs out there to say, don't stop in our community. We wanted the police to block the traffic, and if they couldn't block it, then control it appropriately so that we can make sure that our town was safe.
But New South Wales Health rejected the request, citing social and economic impacts. The minutes of the emergency committee show police then said the Wilcannia community must be aware of what they can do as opposed to what they want to do.
It wasn't a want, it was a need. A want is, a luxury thing, but we needed protection and we needed support.
After rejecting the visitor ban, officials at the committee refused to pay the $15,000 cost of electronic roadside signs to tell drivers not to stop. The community's children resorted to making their own signs, but traffic into town continued. The minutes also show the committee was repeatedly warned about overcrowding. Bureaucrats shut down a desperate request from the community for tents and sleeping bags so they could isolate, with one senior health official responding, COVID-19 is the issue here, not overcrowding. The minutes also note overcrowding was here before the outbreak and will be here well after. Solving one problem will create 5 more.
It shows a lack of understanding of the context of Wilcannia, and secondly, it shows a lack of understanding about COVID. If somebody's desperate enough to be saying, I'll stay in a tent so that I can isolate, if somebody's desperate enough to be saying that, that should be ringing alarm bells for you.
This year, when COVID arrived in Western New South Wales, the committee heard warnings Wilcannia could be next. 7:30 understands that as recently as last August, 2 weeks before the Wilcannia outbreak, the committee discussed that a funeral could become a super spreader event. But the state government announced a lockdown across regional New South Wales a day too late. 3 weeks after the outbreak began, a fleet of camper vans finally arrived for COVID cases to isolate. In this town of 745 people, at least 152 caught COVID, Australia's highest rate per capita. Across the state, at least 12 Aboriginal people died in the Delta outbreak, including a man who travelled to Wilcannia for the funeral. This month, with Wilcannia finally COVID-free, the nation's health chief hailed the response a success.
That has been an extraordinary story. Door-to-door vaccination, local leadership, and we are very, very aware of the risks of outbreaks in these communities and monitoring them very carefully.
New South Wales Health declined an interview, but in a statement said it worked to address local challenges with the federal government's vaccination rollout and helped lift the region from 17% first dose to above 70%. It said its response also included daily health and welfare checks. New South Wales Health said it initially secured accommodation in Wilcannia, but needed to respond to the community's wishes to remain on country. As Australia begins to reopen, the race is on to protect Aboriginal communities. Indigenous vaccination rates are still 27% lower than the rest of the nation and at dismal levels in some states. Elders in Wilcannia say our leaders can no longer dismiss their warnings.
They did not listen to a community, and for that, they were responsible for the outbreak in the end, in my view.
I want to be a part of a plan that's going to protect me. I want to be part of the solution. Work with Aboriginal people. Work with us. We just want to survive.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.